Dear friends, welcome to our channel. Today's program is focused on men and the topic of decreased potency. Before we discuss how to address this issue and improve male potency, I would like to clarify a few points. Firstly, it is important to distinguish between actual decreased potency and perceived decreased potency. Sometimes, a man may believe that there is something wrong with his potency when, in reality, everything is functioning normally. This misconception often stems from societal pressures and unrealistic expectations regarding male virility. Many men mistakenly believe that engaging in sexual activity multiple times a day is the norm. However, the truth is that, for the average man, 1 or 2 times a day is perfectly normal. It is essential to understand that individual preferences and capabilities may vary, and comparing oneself to others can lead to unnecessary worry and dissatisfaction. External influences, such as conversations with friends or exposure to explicit content, can also contribute to feelings of inadequacy. It is crucial to remember that everyone's sexual experiences differ, and what works for one person may not work for another. It is unfair to judge one's own sexual performance based on unrealistic standards portrayed in movies or anecdotes from others. Furthermore, it is common for sexual frequency to decrease with age. While a man in his youth may have had a higher libido, it is entirely normal for sexual frequency to decrease over time. This decline is not indicative of impotence but rather a natural part of the aging process. Another scenario is what we can refer to as forced swan fidelity. In some cases, a man may experience difficulties in achieving sexual satisfaction with a mistress while having no issues with his wife. Similarly, there are instances where the opposite is true. These variations in sexual compatibility can be attributed to various factors, which we will explore further in our program. Additionally, some men may face challenges in maintaining firmness during intercourse when using a condom. It is important to note that this is a normal reaction for many individuals. Condoms are essential for safe sex, particularly when engaging with new partners. However, it is not uncommon for men to experience temporary difficulties in maintaining an erection while using a condom. Lastly, some men may reach orgasm quickly, leaving their partners unsatisfied. This can cause significant anxiety and lead to concerns about potency. And the paradox is that this is not the case at all. On the contrary, reaching orgasm quickly is often an indication of a man's normal sexuality and sexual power. It is important to bring this to your attention once again. If a man reaches orgasm too quickly, it is often a sign that he is hormonally fine and has heightened sexuality. However, measures can be taken to ensure that the woman also receives pleasure. Firstly, delaying the onset of male orgasm can be achieved by wearing a condom in such cases. Secondly, engaging in repeated sexual intercourse may help prolong the man's orgasm. By having multiple encounters, the man's orgasm is likely to take longer. For those who climax too quickly, one doctor's advice may seem unusual but can be beneficial. A man can reach orgasm on his own, satisfying himself, before engaging in intercourse with the woman he loves. This can help prolong the overall sexual experience. Now, let's discuss the reality of decreased potency. This refers to cases where a man may have only one sexual encounter a day but lacks the desired stamina. While some urologists may attribute this to prostatitis, the main symptom of prostatitis is pain in the perineum, and decreased potency is not as common as one might think. The most common causes of decreased potency are primarily psychological. Men may experience a decrease in potency when there is anxiety or fear of failure during sexual intercourse. This can be influenced by past experiences of failure or overexcitement resulting in premature ejaculation. It is important for men to understand that such experiences do not indicate a permanent decrease in potency. Another cause of decreased potency is a sedentary lifestyle. Prolonged periods of sitting, whether at a computer, behind the wheel, or on the couch, can lead to poor blood circulation in the pelvic area. Over time, this can impact potency. Therefore, it is essential for men to engage in regular physical activity and exercise to improve blood flow and address this issue. The third reason for decreased potency can be attributed to the use of certain medications, including blood pressure medications, cholesterol-lowering drugs, known as statins, and diuretics. These medications can also potentially cause gynecomastia, which is the growth of breast tissue in males. Another cause of decreased potency is the disruption of one's intimate life rhythm. This usually occurs when there are long intervals between sexual intercourse, such as in the case of drivers or sailors who go on business trips and return home infrequently. This irregular rhythm can lead to a decrease in potency. The fifth reason for a possible decrease in potency is nervous overstrain, which refers to mental exhaustion and a lack of sleep. Adequate sleep is crucial as it promotes the production of the male sex hormone testosterone. It is recommended to get at least 7 to 8 hours of sleep to maintain healthy hormone levels. Bad habits, such as excessive beer consumption and smoking, can also contribute to decreased potency. Nicotine, found in cigarettes, causes the constriction of blood vessels, including those in the penis. Similarly, vasoconstriction of the penis is often associated with type 2 diabetes. Therefore, it is important to actively combat diabetes if diagnosed. Excessive weight is another factor that is often linked to decreased potency. Although this is a widely discussed topic, it is essential to note that being overweight can impact one's sexual performance. Additionally, age-related changes play a significant role in decreased potency. After the age of 50, most men experience a decline in testosterone levels, albeit at different rates. This hormonal decrease can result in a decrease in potency in some individuals. Lastly, it is crucial for men to prioritize the health and readiness of their partners during intimate encounters. Engaging in sexual activity with a partner who is not physically or emotionally prepared can be detrimental to both parties involved. Warm-up and mutual consent are essential for a healthy and satisfying sexual experience. It is crucial to consider a woman's emotional state and readiness for intimacy before engaging in sexual activity. When a woman is in a romantic mood, feeling good, and properly prepared for intimacy, her body naturally produces a lubricant that contains enzymes. These enzymes surprisingly enhance a man's erection and increase the penis's resistance. However, if a woman is not ready or is irritated and reluctantly gives in to her partner's demands, the opposite reaction occurs. In such cases, the woman's body perceives the intimacy as violence, and the lubrication produces antibodies that weaken the erection. Therefore, it is advised for men to avoid engaging in sexual activity with a woman who is not ready or willing. Now, let's smoothly transition to discussing the treatment of decreased potency and how to increase it. There are various medications available, but not as many as advertised to make a man a sexual giant. Herbal medicines can be a good starting point. Hawthorn-based remedies have a vasodilating effect that can potentially improve potency. Another group of herbal preparations, known as medicinal stimulants, includes ginseng, Chinese lemongrass, and rhodiola rosea extract. These can also increase potency and cause general arousal. However, it's important to note that these herbal remedies may not work for everyone. B vitamins can also be beneficial for increasing potency, especially if it has decreased due to general fatigue or insomnia. If vitamins in pill form are not preferred, a bee product called perca, also known as flower pollen, contains numerous vitamins and trace elements that can enhance overall tone and male strength. While medicinal herbs and beekeeping products may not always provide the desired results, therapeutic exercises can improve blood circulation in the pelvic organs and help treat prostatitis while improving erections. Additionally, medications like Viagra and its analogs have proven to be effective in most cases, although they do come with contraindications and certain nuances. Some urologists and andrologists may prescribe testosterone preparations, but it is not an approach I favor. Taking testosterone in pill form can disrupt the body's natural production of this hormone. I believe this method should only be used when there is a persistent decrease in testosterone levels in the blood. In other cases, it is better to explore medicinal herbs or lifestyle changes, such as therapeutic exercises. That concludes today's discussion. Take care of your health, stay well, and consider subscribing to our channel for future updates.